Hello, this is Dr. Bedinghaus, and we are so excited today to have Dr. Penny Montgomery as the person that we're going to interview. Now, Dr. Montgomery has had extensive history in working with patients using neurofeedback, helping restore optimal brain function and minimize or eliminate some symptoms in common disorders like traumatic brain injury, injuries to the brain that develop into dementia later on, anxiety, depression, panic attacks, post-stroke, and just a variety of other things. She's an amazing person, and we're going to be so excited to hear what she has to say. She received her PhD from North Texas University in Denton, Texas, and in 1968 she began working in neurofeedback at the University of Texas Health Science Center in San Antonio. She also developed and managed a pain management program in a hospital in one of our major cities. So I am so excited to have Dr. Montgomery with us. So good morning.
Good morning, and thank you for having me, Dr. Bedinghaus.
Yeah, it's a thrill and pleasure, and I get tongue-tied just thinking about it. So anyway, I thought the audience would like to hear a little bit from you about how you got involved in this wonderful work of helping people have a better brain. So you want to give us a little background history about what drew you into the field?
Well, there's more than 50 years of history, so I'm going to try to make it short. Back in 1967, I had the opportunity to go to the University of Texas Health Science Center at San Antonio with a government research project studying blood flow to the brain in the elderly. That was a brand new medical school at that time, and there was not a focus particularly.
Oh boy. Okay, we've got a little freeze problem here. Okay.
Dr. Barbara Brown came to the medical school and gave grand rounds on a technique called biofeedback, which really didn't have a name yet. But she and I hit it off as friends, and she was very popular with the faculty there. And so the decision was made to dedicate the laboratory in the Department of Psychiatry to a phenomenon that she called biofeedback. It did not have a name yet in the literature.
Okay.
So we developed a laboratory wherein we could measure the function of different organ systems and stress them a little bit, see how they changed, release the stress, and see how quickly they return to normal. Mm-hmm. Using that technique, we worked with people with a whole variety of symptoms. And our approach was to determine what organ systems were either causing or contributing to the symptoms. And then we would measure those organ systems and, as I said, stress them a little bit, mm-hmm. and then see how quickly they return to normal. Those that did not return to normal within the limits that medicine thought they should were considered to be out of bounds due to some kind of stress, something that altered their function.
Mm-hmm.
Sorry. I have to take my dog out. Sorry.
The dogs are welcome here. She was in the background somewhere, so that's fine.
Sorry. She may have to take her out and just close the door. So I've got a dog that is she's just finishing her puppyhood, and she's a little loudmouthed. Anyway, she's a beautiful standard poodle. Love her, but she's noisy. So anyway, we proceeded then just to look at what target organ systems were really stressed, and we would measure them. And then we would allow the client, the person producing the physiological signal, to actually look at the signal on a screen, on a computer screen in real time, and gave them a reward, a sound usually, if the organ system function was returning closer to normal. That's what biofeedback is. It's really just information. It gives the client information about how their organ system is functioning. And so from there, we evolved into neurofeedback, which is just a biofeedback, but uniquely of the brain. So the folks that got invested in brainwave biofeedback, because the brain produces electrical activity also that can be measured, and actually all the different organ systems do. So we look at the signature of the way the organ system is utilizing the electrical activity, and that tells us how it's functioning. But those that were doing brainwave biofeedback felt that they should be a little bit separate from those that were measuring such things as finger temperature, skin conductance, gastro response, and the like. So a new division was created called neurofeedback, which is just biofeedback of the brain. So in that case, we're really giving people information in real time, visually and auditorily, about the way the electrical activity is moving within the lobes and structures of the brain. I consider the brain a committee rather than an organ, a committee made up of lobes and structures, each with its own job to do, but they must communicate. And they communicate by electrical impulse, moving along the neuronal pathways. And that's what we measure. So basically, we're very interested.
So how do you tell a little bit about how you get the EEG?
How we get it? We place sensors on the scalp with conductive paste, and we just record the electrical activity that the brain is emitting through those sensors. It goes into the computer, which analyzes it and converts it to digital and displays it on a screen. The closer we can do that to the time the actual event occurs in the brain, the better the neurofeedback. So when I mention real time, that's a dream, of course, because it isn't exactly real time. But we need to be able to do that within a microsecond or so, because the client may be reinforced with the reinforcing sound for producing whatever that signal was, and we want it to be what the event was. We don't want it to be separate from that, because we might actually reinforce the wrong thing taking place in the brain.
So what kind of things do you use to feedback the signal? Sometimes games for kids.
I really prefer the raw EEG signal. It's been interesting to me over the years. We've had every kind of feedback mechanism and display known to man. We've had light, we've had sound, we've had vibration, we've had games, we've had music, we've had beepers, all kinds of things. But what we found is that the more we add to the raw signal, the longer the delay is between the time the event occurs in the brain and the time the reward occurs on the screen.
Yeah, that's an interesting point.
Yeah, the worst thing that can happen with that, if the delay is too long, you might actually be reinforcing seizures. So we really want to make sure that the display is very close to the event in the brain.
Yeah.
So it is interesting that people seem to enjoy looking at their own raw brainwave, which we can get recorded and displayed to them much faster than any or anything else, that it creates another stage in the signal. And people get fascinated with their own brainwaves. It's interesting to me how fast the brain will change. When I use raw brainwaves to do an evaluation, I record 6 or 7 or 8 different places on the brain. And I found that if I may start on the left side and then go around the head. And what I found is that if I allow the client to see those brainwaves in the beginning, by the time I get to the other side, the baseline has changed. And that's the brain has changed it. The brain is so quick to repair itself if it has the energy to do so and information that is required to do it. The reason the brain stops healing itself after an injury is that it no longer is receiving the information. The brain habituates to abnormalities that occur
No.
after injury. And so the brain no longer seeks out the damage to repair. And that's one of the main things about neurofeedback, is that it keeps bringing the brain's attention back to the problem.
What kind of conditions have you've treated a gazillion people over the years, but could you give us a few examples of patients that you've seen over the years that really had pretty dramatic results? Does that seem
Yeah.
possible?
Well, yes, one of the things that I participated in was actually helping people awaken from level 2 comas over weekends. And we do that because we were able to, with the technology we were using, we were able to help the brain move electrical activity from the areas where it was while they were in coma back to the frontal lobe, whose primary function is initiation. So if we can find some good electrical activity and through the neurofeedback process, move that electrical activity into the frontal lobe, eventually the frontal lobe gets enough energy, enough electrical activity to initiate awakening. We did that with 42 people in
Wow.
comas. The longest one person had been in a coma was 6 years. And
Well, that's pretty amazing.
it is. And our
Yeah.
experience, 40 out of the 42 came out of their coma in the 3-day period that we worked with them. So I would say that's probably the most dramatic application
Yeah.
feedback experience with. On a day-to-day basis, I see people who have had traumatic brain injuries that have genetic symptomatology like attention deficit disorder, that have had strokes,
Yeah.
that have dementia. I participated in a study where we looked at 30 former NFL players that were retired and had early onset. Well, was early onset age-wise, but these folks had had many concussions on the football field. And so we saw 30 of those folks, mostly people who had played for the Denver Broncos. Some had played for other teams. And we found that the football career usually lasts about 3 years because of the decline in cognitive function after that time.
Yeah. That's scary.
So it is a couple of people we had, and one actually I'm still seeing on occasion, had 17 years as a football player. And it was interesting to me because when I look at the brain maps of football players, by the time I had done about 15 of these people, I was able to look at the brain map and see where the area of damage was in the brain. And I was able to tell what position they played.
Wow, that's interesting.
Because of the area of the brain that was involved. And so it's been interesting to me to see how the NFL has dealt with that problem. The damage comes when the brain actually hits the inside of the skull. And so they keep building better helmets to try to cushion those injuries, but all the helmets are on the outside of the head. And it doesn't help with what's going on inside, that the brain is hitting the inside of the skull. So actually, unless they build a helmet that goes under the skull and over the brain, they're not going to be able to stop it with a helmet.
So when we think about young people who are playing soccer and hitting the ball with their head, I know we've worked together on a few young people who had several concussions, but they just didn't seem to want to stop playing that sport or stop using their head to hit the ball. Do you have any thoughts for parents? What would you recommend to parents about children in contact sports?
I would say if they're sloshing their head around, or their head is quickly changing positions, or they're using their heads as a battering ram, don't do it, because there are those people who are going to have part of their brain turned to mush because it hits the inside of the skull often.
Boy, that's a huge issue.
It is a huge issue. Well, fortunately, some people are beginning to pay attention to that issue. My solution for the NFL is to stop making hard hats and put these guys back in those flimsy leather helmets that they used at the beginning of football. And there were no, excuse me.
Okay. Those dog lovers, we know how that happens.
Well,
That's fine. That's fine.
Yeah.
So
When they were using those leather helmets, there were no brain injuries. There were shoulder injuries because the football players didn't feel like they could use their head as a battering ram. So it's, it's all, it could be, the bottom line is it could be prevented.
Yeah. Yeah, that's true. And here in Colorado, people in mountain biking, they're going flying over cliffs just about and having head injuries from that, even though they have a helmet on, which may end up being actually split apart during their fall or their traumatic accident. So that's a major thing. And, also people who are in car accidents, whiplash injuries. I think I've actually referred someone to you there in Arizona who had a whiplash injury. And what happens, what kind of symptoms do people get after they've had even a mild concussion, much less a major injury?
Well, research has shown us that a single concussion can result in dementia years later. Wow. There is bruising of the gray matter, which is on the surface of the brain, but there are also cracks in the white matter that go deeper into the brain and interfere with the neuronal pathways. It's like there's a split in the road, and the electrical activity can't pass over those areas. And over time, the problem becomes worse and worse with aging because the brain naturally slows down anyway. And the traumatic brain injury or the concussion has caused the brain activity to slow down so that the information moves very slowly from lobe to structure. And it also causes it to lose amplitude or energy or strength. And the brain has to have a certain amount of strength in order to function. So when we see areas of loss of amplitude or strength, we know that those areas simply can't do their job. But it is interesting because so little attention in our culture is paid to dementia due to injury. I actually looked at 200 residents of an Alzheimer's unit, and the diagnosis, as you know, is when there's cognitive dysfunction and loss of memory, the knee-jerk diagnosis that they're given is Alzheimer's disease. And so I was looking at 200 residents of an Alzheimer's unit, all who had been diagnosed with Alzheimer's. And there is a very distinct difference in the shape of the brain waveform in someone with Alzheimer's or progressive dementia, as opposed to someone with an injury-related dementia, which can be remediated. So in this group of 200 people, what I found is that 80% of them had been misdiagnosed. That 80% of that 200 group had an injury-related dementia that could have been remediated. Only 3% had a progressive diagnosis. So I think it probably makes a case for looking at brain waves whenever there's cognitive dysfunction and not just basing a diagnosis on symptoms or behaviors.
Yeah, I could not agree more with that. I think we had talked one time every assisted living or nursing home should have a neurofeedback department.
Absolutely.
And I think we talked one time about when people are in neuro ICU from traumatic brain injury, nobody's looking at their EEG. We
That,
monitor their blood pressure, their heart rate, the respiratory rate, and other things, but monitoring their EEG. So that's a big issue. Now, there's so many things that we could talk about, but I do want you to say a couple of things about ADD, ADHD,
okay.
and the use of neurofeedback, and I'll just say neurotherapy. That includes neurofeedback, but sometimes we do neurostimulation before we do neurofeedback. This is a very even the American Academy of Pediatrics several years ago came out and said, yeah, neurofeedback can help kids with ADHD. So can you speak to that just for a moment?
Yes, I can. Let me just do something here. Looks like my device is about to lose battery power. Let's see, what can I do? Let me get some battery power for it.
Now, folks, don't forget to make comments or ask questions so that we can be sure we fully utilize this wonderful time with Dr. Montgomery.
Okay. Well said. Now, with respect to attention deficit disorder, it is, the symptoms really are of immature development of the right frontal lobe. If you look at but it's a genetic disease. It occurs in families. Mm-hmm. And what we see is that the right frontal lobe is smaller and slower than the left frontal lobe. And so what we do then is compare the function of both frontal lobes. And when we find that there's an immature brainwave pattern in the right frontal lobe, then we know that we have attention deficit disorder. Unfortunately, attention deficit disorder is diagnosed, again, too often when there is any sort of frontal lobe problem. If you look at the diagnostic manual for frontal lobe disorder, you find that all of the behaviors that are listed are regulated by the frontal lobe. So if you have damage in the frontal lobe from an injury, a difficult birth, a near drowning, almost anything else, you'll have symptoms that mimic attention deficit disorder. So again, one of the most important things to do when you have a child that you suspect has attention deficit disorder is to look at the brainwave.
Yeah.
And so what we do then is do neurofeedback. We instrument the right frontal lobe, and we encourage, or we set a goal for that right frontal lobe to include a faster and higher brainwave. But we also have to look at the hyperactivity component. Mm-hmm. ADHD includes hyperactivity, attention deficit hyperactivity disorder. But what we find is that in a great majority of children with ADHD, with the hyperactivity component, that hyperactivity seems to be due to an allergic pattern in the frontal lobe. It's a very high, fast pattern that occurs in the presence of an allergy. So you can have a child who's doing well in the classroom in the morning, and then they go to lunch and eat something they're allergic to, come back in the afternoon, and they simply can't sit still. And that's where they get diagnosed with the hyperactivity component. So we need to look carefully at those brainwave patterns, because the attention deficit disorder pattern is slow. The hyperactivity pattern is fast. So we need to be able, again, to look at the brainwave pattern before making a diagnosis.
Yeah, well, that's why when we have a patient who wants to do neurofeedback, I see them first as a functional medicine doctor because I need to find out so much about their birth history and also their GI history. When do they have GI symptoms? Because if they do, that's going to make them more prone to developing allergies. So that's why it's so important to take such a broad perspective with patients rather than just doing neurofeedback. And that's what I found very helpful in our clinic here. So the bottom line is these kids can be helped, right?
Oh, absolutely.
Yeah.
Absolutely. And if you
Okay.
do the protocol correctly and include heart health and gut health, when you're looking at brain function in attention deficit or ADHD even, you should be able to clear up the condition in less than 20 sessions if you do it correctly, like you're doing, with a broad spectrum approach. People
Mhm.
who just do neurofeedback and don't look at the other aspects, the literature says it takes 40 to 60 sessions sometimes.
Yeah. We found that out.
Yeah, good for
You can't
you.
take you can't take a shortcut because sometimes I can't get parents to do some of the dietary changes I recommend. So parents out there, listen to Dr. B. Now I want to say one more thing about peak performance and just people in general getting an EEG to find out how well their brain is functioning. Would you agree with that?
Oh, absolutely. Absolutely. You know, you can't be on this planet for very long without having some area of suppression in your brain.
Yeah.
Uh, and that's what's really the big factor in cognitive dysfunction, memory loss, attention issues. It's areas of the brain that are suppressed, and that information just isn't moving in a normal manner. It isn't moving fast enough, and the energy isn't there. Any kind of an injury is certainly going to cause that long labor. You know, so there are forceps. We see head injury patterns where forceps were, you know, on the brain late in life. You can see, you know, 50-year-old person, you can find where the forceps were in their delivery. And certainly the suction delivery, you know,
Yeah.
what that is, I don't so much, except that I see brain function. And what we see on those suction deliveries is that the whole top of the head, the whole crown of the head is suppressed. And so we just need to look, everybody needs an EEG to find out how their brain is functioning. Do they have adequate energy and adequate speed in all of the structures of the brain? Because they're
Yeah.
so important.
Yeah.
What?
And we frequently have a lot of patients who come in with brain fog as either part of their symptoms. And after we've done a thorough evaluation and try to get to the root cause of that, then I really encourage them to get an EEG so that we can find out can we help your brain function better. So it's so important. That's why I've spent this whole week talking about mental health in our Facebook group for functional medicine. And it's amazing how many people have some brain dysfunction. And I know that I do sometimes, don't have enough energy in my brain. So, and
Yeah.
what about, do you ever work with people who just want their brain to function better or have peak performance? We've had a few people wanting to just have a tune up of their brain.
Absolutely, absolutely. And you know, I encourage people to have their children have EEGs and put them in the vault, because if anything happens later on, you can do another EEG and you can compare the two, and you can see exactly where the problem is.
Yeah.
And you can go right to the problem without a lot of excessive diagnostic work, which is very, very cost effective and
Yeah.
efficient to create a more normally functioning brain. But there's just no way you can be on this planet for very long and not have some issue with brain function. You know, I just finished co-authoring a book that shows unique brainwave patterns for 30 different medical conditions. And it's amazing how you can look at the pattern in the brainwave and you can actually tell what caused it. You know, we're seeing some very interesting changes in brains with COVID. And
Oh boy, yeah.
I had a opportunity to do a lecture to a group of students, and one of the things I really focused on is how the brain changes with COVID. And these people who are called long haulers, not the truck drivers, the ones that have long-lasting COVID symptoms, you should have a look at their brains. It's really amazing. It's not only the brain tissue that is involved, that changes with the COVID, but it's also the vasculature of the brain.
Yeah.
If you look at the arteries, you see that the walls of the arteries are extremely inflamed. And there's a bacterial component that is continuing to work on those artery walls even after the COVID virus is no longer active. It's really amazing. And of course, we're seeing blood clots. We're seeing so many post-COVID symptoms that have to do with the cardiovascular system. And I think it's because of the changes in the artery walls.
Yep. There is so much about our wonderful body. I'm constantly amazed. And our brain is so very, very important. We cannot live without it. And, you know, I'm so grateful that you decided to come on board with us here on this interview. Do you have any kind of final words you'd like to say to the people who are listening to us?
Well, yes. You know, I've been at this now for more than 50 years, and I never cease to be amazed at the wonder of how beautifully we are created and how elegant our brain is. And I know that our brain is specialized for two things, learning and healing. And in the work that I do with brains, I tell people it's your brain that's doing the healing. I just take the credit.
Mm-hmm. Yeah.
But I think if we give our brains what it needs, then it's going to last a long time and function very, very well.
That's right. And I think that is so important. And that's why I really am excited to have your words of wisdom. Now, if anybody wanted to contact you, how would they do that?
I have a website. It's called newhopeforthebrain.com. And the contact information is on there. And I would be delighted to hear from anyone. If anyone has questions, just text or phone, and I would be more than happy to respond.
Okay, and I'll have Tom put that in our comment here. Okay. Okay, thank you so much. Thank you from the bottom of my heart for spending a little time with us, okay?
Thank you for having me, and I apologize for the technical problems.
Oh, it's fun. The first time I did one, we had all kind of technical issues, so that is just fine. Thank you so much, and give your sweet puppy a pat on the head for all of us animal lovers here. So there, Tom has put the link to your website right there. Okay.
Thank
Now,
you.
yeah, I don't see anybody that was brave enough to make any comments yet, but if we get any questions that later on, we'll be sure to pass them on to you if I can't answer them, which is probably likely. So anyway, thanks a lot.
You're welcome.
Okay.
Have a great day.